the OECD, which is the main source for these kinds of data, they go around and they say, okay, tell us, you know, what your health spending was. Well, in Japan, for example, that you may have heard, the proponents of healthcare reform always rotate through countries. Have you noticed that? You know, for a while, Clinton, it was Germany. Germany is great. We need to be like Germany. And then it was, we need to be like Canada. Lately, they've been picking things outside the English language Commonwealth area so that you can't read the literature as well. So they've been talking about, you know, France for a while. I kind of read French. German, no, I don't read German, and I'm glad that's gone. And now, oh, it was Switzerland. Well, the good thing about Switzerland, there's 3 languages, so you can sort of read that. If they do it in something like Chinese or Korean, it's hopeless, right? Japan. Well, they've been doing Japan lately. I've seen some. When they report national health spending, they don't report anything outside the national health insurance spending. Okay? So if it's not covered by the national health plan and you just buy it out of pocket, that's not healthcare spending. When OECD went and looked at what would happen to Japan's spending if they included those amounts, the cost of Japan's spending would be 125% of what is reported now. Okay, it would be much higher. The same is true for Denmark. That's been a country that we've been hearing a lot about, how wonderful they monitor patients in their homes and stuff. They exclude long-term nursing care. You think that has something to do with the difference in those graphs? That's pretty expensive stuff. It's about 1/3 of Medicaid spending. So if you included that in the Denmark stats, you know, they would have to raise their spending amounts by another 25%. And then in U.S. spending, stuff that we include in our spending that other countries don't is research and development. The only country that includes research is Germany. The others in Europe don't. And if you include spending by foreigners within the country, in the U.S., we include spending by foreigners. There are a lot of Canadians, I don't care what they say, who come over the border. How do I know that? Because I can go to Buffalo and look up an MRI imaging center and they give their prices in U.S. dollars and Canadian dollars. It's got to tell you something. Even without the terrific work that we did, I don't know if you've seen some of the studies when we went to Vancouver. We have some great video on our website again for that. You should take a look. So, expenditures are what we're being talked about, but expenditures aren't what matters. Expenditures and costs are what matter. And how do we reduce costs in the U.S. system? And what if, and this is the really scary thing to me, what if the U.S. system is already more efficient than other countries in terms of less waste because there's less government control, but people in the U.S. just get more health care and get more out of it? And so this goes into measuring outcomes. We're told a lot that U.S. outcomes are awful. Well, that matters what you measure. And let me give you a great example of that. The U.S. is worse if you rank, I guess you've been beating up the WHO study, which is a great thing to beat up, so let's speed it up some more. Okay, 1/4 of the rankings in the WHO study depended on whether the health system was publicly financed. Okay, I guess the U.S. isn't going to do as well then, right? It depends on whether you rank a healthcare system on infant mortality. And we're always saying U.S. healthcare bad, infant mortality is high. Well, gee, it turns out there's different definitions of infant mortality in different countries around the world. And so, given that some countries, if the baby's under 1 kilogram, they say it's dead at birth even if it's breathing, and just set it aside to die. Well, if you get rid of the babies who are most likely to die in the first 24 hours, you have a great infant mortality rate. You have lousy health care, but a great infant mortality rate. If you classify kids by birth weight, the U.S. does better than any other country in the world. So on that depends on what you measure. Commonwealth Foundation. The Commonwealth Fund is one of my favorites. And they're one of the backers of this all-payer database bill that somebody asked about. Okay? The all-payer database bill basically simply says that every payer in Colorado has to report on every healthcare transaction and make medical records available to the state as the state wishes for storage in a big database. Period. There's no other protection, there's no opt-out, and the fines are unlimited if you're in. So if it's passed the House, I believe, so if you have a senator and you don't like this bill, then you might think about that. But that's the all-payer database in a nutshell. We have a position paper on it if anybody's interested. So, Commonwealth, not at the top of my love list right now. Commonwealth goes around and grades healthcare systems around the world a lot, and it grades the U.S. system based on whether people say they're worried about the expense of healthcare. Well, if you go to the US, people say, yeah, we're worried about the expensive healthcare. And if you go to Britain, they say, nah, not so much, because they don't have to pay for it, right? But if you ask in the US, are you worried about being able to obtain healthcare, people say, no. And if you go to Britain and you say, are you worried about being able to obtain healthcare, they go, you bet. The lines are long, they won't treat us, and so forth. So Commonwealth says, oh, US system bad because it's expensive, and they don't talk about how long you wait. So you have to watch out for the measures. But when you measure things that count, things like cancer survival, population blood pressure gradient, hospital adverse events, we have a lower rate than anywhere else they've been measured in the world. Disability-free lifespan, the rate of dialysis or transplant for people 45 to 84. In the US, it just happens to be 5 times that in the UK, mostly because if you're over 55 in the UK, you don't get dialysis. They just say, oh, cheaper to let you die. Okay. So outcomes really matter. If we do this, or if they do this to us, whichever hates me. Projector. Genius. This is why I'm the numbers person, but I don't do stuff. One thing that's going to happen is administrative costs are going to explode. Now, we hear a lot about, evil private health insurance companies, which turn out to be way better than government health insurance companies, even though insurance is the sort of thing you hate to buy because you feel you get nothing out of it, you just send money away unless you're in the car crash, but how many people really are? One of the things, this is from Kaiser, which is by no means a right-wing, crazy organization. And one of the things I think it's interesting to note is when the insurance company overhead started to rise. Which year? Well, I'd say, what, about 2000, let's say? Just as an example, what passed in 2000? Big healthcare legislation. What went into effect in 2000? HIPAA. Think that would have affected administrative costs? Okay. Just again, has HIPAA actually done any good? No. All it's done is said that your records are accessible to anybody from the government, but not to anybody else. That was really a useful thing. What they basically did was lift about 100 pages of regulation from the Clinton healthcare proposal in '92. That's where HIPAA came from. And the all-payer database you will have all HIPAA protections in it, which is misleading because HIPAA is voided by any state law and all public health authorities have access to any of the data. So if the all-payer database goes through, you don't have any protection at all for your healthcare data. So that's an example of what will happen when Obamacare goes through. We're going to have regulation up to here and beyond. Already, there's a study by Chris Conover of Duke University which says about excess regulation costs about 10% of annual U.S. healthcare spending. In other words, there are regulations that do no good that we could get rid of that would save us a bundle of money. I just talked to somebody who went through a nursing home review. They go through it every year. They had one of those, 4x8 tables, totally covered with binders full of paper, so that the state inspector could come in and leaf through it looking for paperwork violations. It had very little to do with the operation of the nursing home, cost a phenomenal amount of money. Reorganizing, just redoing some of the legislative codes would be very, very, very helpful.